You are now listening to the Project Kuwait. To the Project Kuwait. To the Project Kuwait. Where we stop at nothing to bring you the right facts on health, fitness, and psychology. Featuring some of the world's most experienced professionals. So you can learn, lift, and live. With your hosts, Meg, Dr. D, and Mehdi.
It's based out of Charlotte, North Carolina. I've been a therapist now for going on 3 years, but then also I've been working in the mental health field for about 13 years. I'm actually a PhD student too at the Chicago School of Professional Psychology, getting my PhD in international psychology. But one thing is helping them understand where the anger comes from. What actually feeds into it? What are your triggers into that anger? Is it your environment? Is it your home life? Is you dealing with an abusive parent or any of those types of things? Helping them identify those things, but then also figuring out how to channel their anger. I definitely appreciate the work that you all are doing when it comes down to addressing these issues from a different perspective. A lot of times it's one thing we talk about mental health and just mental illnesses, but then you got to add that cultural aspect to it. And you have to add that perspective to it. From the athletic standpoint or even from the ethnicity standpoint, it's important.
All this and more in today's episode. Now you can introduce him, Dr. D.
All right. Well, Rwenshaun has to introduce himself. I was so happy that you reached out on Instagram. Actually, Mehdi, Rwenshaun was supposed to come and be part of that MEPA conference that they always have here once a year.
Oh, really?
I think last year. Were you here last year? No. Yeah, it's by Joanne Hands. Remember Joanne? She's the president. She was working at AUK. And so this year, it was supposed to be in March, right, Rwenshaun? And
it was supposed to be last week.
To cancel it. It was supposed to be last week. So you didn't come last time, but you were going to come this time.
Correct.
Yeah. Okay. Yeah. So tell us a little bit about yourself and your background.
Okay. I'm a licensed therapist based out of Charlotte, North Carolina. I've been a therapist now for going on 3 years, but then also I've been working in the mental health field for about 13 years. Actually a PhD student too at the Chicago School of Professional Psychology, getting my PhD in international psychology. So we were supposed to come out to do a field experience last week. It was supposed to be there for about 2 weeks. And that's where we were going to come to Kuwait. We'll go to the MEPA conference, and then also do just some tours and then do a little bit of consultant work and just experience the culture and understand how it interacts with the psychology aspect of it. So that's why I was supposed to come out there. But been in the field for a while and just in various capacities. And it's something that is a passion of mine where we're to raise awareness, but then also get people the help that they actually need to get.
Wow, that's very interesting. Well, you could have had a really great experience doing that with the conference. So
that's awesome.
And
sorry, I got to cut you off, Dr. D. Dude, I wanted to give you major props for doing adult coloring. I think that is awesome.
Yeah.
It's one of the most cathartic things that I have been introduced to over the years. And to see someone promoting adult coloring this day and age, I'm like, dude, this guy's awesome.
I appreciate it, man. I appreciate it. It's something that's...
And you know what? I noticed how many people were really enjoying it. That's, usually you're like, coloring, you don't think of it as adult, kind of an activity, but you seem to really get people into it.
Yeah, so that's one of the beauties of it, just to see the community come together and be able to actually incorporate things that we used to do in our childhood that we may not do anymore, but it can also, like you said, it could be cathartic and it could be a method of self-care. So I do host those events through my nonprofit, which is Eustress Inc., and I use those to raise awareness in the communities, but also give people the skill sets to be able to address their issues in between therapy sessions, of course. So host one here in Charlotte. I've done one in Chicago, done one in New York, done in Atlanta. So the goal was to eventually do them nationwide, and I eventually want to do them worldwide.
Mm-hmm. Wow. Chicago, my hometown. Yes. I'm a Chicagoan. So it's true. Yes, that's right. So I'm so happy about that. That's very true. So now tell us, how are things there? My God, are people stressed? Are you guys on lockdown now?
No, we're not. Not everyone is not on lockdown yet. Some states are, I think California and New York is currently on lockdown, but then other states are not so much, not yet anyway. So some people are taking it more serious than others, but in the states that are not in lockdown yet, you have people just still out and about. And so they don't really understand the severity of it quite yet. So even with a lot of misinformation that's being gathered, a lot of people, anxiety levels are going up. The fear levels are going up. So they're starting to really panic on certain aspects. But people are still going to the stores. They're cleaning out the stores, with bread, water, tissue, all of those types of things. So they're cleaning out those things and preparing, but they don't know exactly what we're preparing for.
Which is insane, especially with the toilet paper over there.
Right. I'm not exactly sure what it is in the toilet paper.
I don't understand issues with toilet paper, but I think we psychologists should try to figure it out.
Right.
What the hell is wrong? Everyone's asking me, why does everybody want toilet paper? And instead of like garnishes or canned food or pastas,
Right.
And I mean, I don't know. It's probably, I don't know, maybe it's a soothing feeling. You realize you're home, you're stuck. You're going to be going to the bathroom. I don't know.
I still do not get it at all.
It's terrible. But here, I guess here we didn't really have supply. I mean, we didn't have, I don't know, Mehdi, I don't think people were running around trying to get toilet paper, but people have a big anxiety and fear. And a lot of people are not understanding. Of course, as you know, people suffer anxiety disorder and even depression. And now everyone's on lockdown. Pretty soon, if people don't really listen, which I think that 80% is listening, the 20% are still minimizing the severity of this virus, that they are trying to act like, nothing is going to happen. So the country is like at the last stage of like probably putting a curfew, but they haven't decided. As of today, they've closed. Now, before they had closed, of course, the schools have been closed for the last month. But the only thing that was open right now was the clinics and private hospitals and, of course, public hospitals. But as of today, they've closed clinics. So I won't be able to see anyone face to face. Like tomorrow, I have appointments and, we give them the choice. Do you want virtual? Do you want face to face? And most people have decided, I mean, some people do. But today the law came out and said, no more patients coming to clinic. You gotta, close. So all these like private clinic towers are closed. All private hospitals, all private doctors are all closing. And so you could see that more and more people, they have to be staying home. More people are wondering, why are they closing clinics? Today, I got a few people asking, like, what do you think it's going to happen? My students emailing me, we don't know what's going to happen. Are they going to, the rule of the education is that we're closed until August. August, we come back and we continue this spring semester.
Oh, okay.
So, of course, the students are wondering, how could that happen? And they don't understand the detail, who makes these rules. The anxiety is up high. And I could see myself also being anxious because I don't really know what's going to happen. And we're trying to, I've become more anxious because I'm surrounded by all these anxious people constantly wanting answers. And I don't really have all the answers. So it's hard, I think. Right now, it's the hardest time.
Very hard. How is it transitioning individuals from face-to-face to virtual counseling?
I've been trying to go web therapy for a while, and I've been trying to promote it because I think for a lot of times people that don't have ability to come to the clinic here in Kuwait, there's a big thing about people seeing you come into a psychologist, or we are in a clinic with another psychiatrist. And so people have a big thing about stigmas. And if they see me in the waiting room or whatever. So a couple of maybe 6 months ago, or maybe longer, I started doing the idea that maybe you don't need to come. We can do this web therapy. Why don't we just think about, and people were not open to it. I had few sessions, sometimes people, but most of the time they want to see you face to face.
Right.
Even though they don't want to be seen by other people there, so they don't know you're seeking therapy. But at the same time, they were not really happy about, they don't want to do web therapy. But now, of course, so now it seems like I've transitioned to only 50%. Obviously, tomorrow I'll have to go all virtual because we don't have a choice. I can't go against the Minister of Health decision or we'll lose our license. So now when they're forced to it, but still people are not very comfortable with it. They want to be able to see you. They want to be in a private room with you.
Right.
Even this virtual idea of like, who's sitting next to you, who's there. Do they have a confidential place where they can talk to you?
Right.
Can they really talk to you about secretive things? So they're probably leery about who's listening, who's not. This kind of sense of paranoia about how much can I tell you on the phone, it probably is eliminated when they're in the office with you and the door is closed.
Right.
So these are, yeah. So I don't know how you guys are probably, you're more advanced because teletherapy has been going on for a long time. You've got all these apps of counselors I mean, on Facebook, they're always advertising this better care.
Yeah.
The idea of so it's a concept that everyone, and maybe the stigma still exists, but nothing like here. Here too, still it exists, the idea of going to a psychologist or psychiatrist, you must be crazy. So they're constant, this idea of already feeling doubtful. So I go on Instagram, and a lot of my colleagues really go on Instagram, and we try to educate and try to explain it's just like any other doctor. You got to take care of your mental health. I do all these episodes trying to talk about if you don't take care of your mental health, your physical health won't be taken care of. But we're a little bit more behind than you guys, technically, definitely, for sure.
Well, even with the virtual sessions here, it's prevalent, but then also understanding that a lot of times insurance companies weren't paying for it. So a lot of times it would have to be private pay in many cases, and especially for the public funded people for Medicaid and Medicare, they weren't paying for that at all. But now, as this virus has started to spread there, and people have to engage in social distancing, they're starting to change some of the laws and change some of the rules for the insurance companies so that therapists can actually engage in those things. And then you actually have to have training in it as well. But similar to you, stigma still is prevalent. I think stigma is prevalent around the world, and it's, especially in my community, is something that I really work hard at to break down the aspect of. That's why I do the coloring nights. That's why I do mental health awareness walks and just other different events that I host. And that's why I started my NGO, actually, because of that. I understand how stigma can hinder us from actually getting the help that we need, because I know what it did for me.
Speaking of that, I have a quick question for you, man. Yeah, no, I'm still here. I let Dr. D go on her rant, and then I jump in with some cool stuff. Looking at it, you're a badass, man. I mean, you were ripped with a six pack. You were, hardcore gym guy, football player. You dabbled in yoga a little bit. So, dude.
And then he became a therapist. See?
No, I know. But the beauty of it is you used to host a night called Locker Room Talk.
Yeah, I do that now.
That's what captured me when Dr. D was like, let's bring this guy on the show. When I looked at your profile and I did my research and looked at your background and everything, I was like, dude, this guy's legit. He was an athlete. I can probably relate to him. So with Locker Room Talk and athletes in general, how hard is it to break that mental barrier for athletes, especially football players, because they have that I'm a man mentality?
Man, it's something that is difficult from an outsider perspective, but then once you get into that room and you're able to actually share your own thoughts and share what you've actually been through, they open up, man. I mean, but a lot of times it's also creating a space where words may not be necessary. Because a lot of times we are not given the words to be able to communicate our actual feelings. Only thing we're actually given is happiness and sadness or anger. And outside of that, we don't know how to communicate, I'm feeling anxious, or, I'm feeling depressed, or, any of those other aspects to describe your emotions. Sometimes we don't even know how to explain that we're scared. So when I created those spaces for me, it actually started off with me sharing my own story with individuals, and then they feel open enough to actually talk to me about certain things and not coming off as a know-it-all or someone that's above anyone else. I meet them where they are. And I think that's one of the major things that we need to do when it comes down to helping individuals to get the mental health care that they need. You got to meet them where they are. I don't expect all of them to come into my office, because that's an intimidating space. And that's something that we're taught to not go into. But then also, I know that if I can meet them in the gym and they can get them to talk, you understand, you work out. So, and you think about with your workout partner, think about how much stuff that you talk about with your workout partner that you don't talk about with anybody else.
Yeah, man. Actually, to be honest with you, I do CrossFit now, so I don't talk much. I used to be a baseball player. I've always been a catcher, so I had the loudest mouth on the team, and for some reason, the guys on the teams always confided in me. I was like the therapist for the team, and I think Dr. D, that's where I got it from. But it was different because the coaches and back then, I mean, my mentality growing up, if I ever had a mental health professional come in and say, all right, we're going to talk about, our emotions and our feelings as a ball player or as a student in general, I'd be like, dude, give me a break, man. So how do you break through to that younger generation that seems to always think they know it all, they believe in it all? So how do you do that? And I saw that you also have an interest in like Tupac. And, I saw that. Yeah, dude, I go extensive in my research. And when I saw that post, I was like, all right, this dude is legit. Do you use music to relate sometimes? Like, how do you break through with the kids?
Oh, definitely. Music, you use arts. That's why the coloring comes in. I even use sports. So I use sports analogies when it comes down to certain things. And you got to speak to them on their language, understanding that, a coach can be just like a therapist for a player. And then understanding when it comes down to, I tell my clients, especially my athletes, when you're dealing with therapy, when you come to therapy, that's like sitting in your coach's office and you watching film, right? But then you still got to go out there and perform. You still got to go work out every day. You still have to put in that work outside of the actual game time to actually be able to reach your top peak performance. So understanding those aspects of it. But then also, you can't talk to them just like, oh, you're an athlete, you got to suck it up and, just push forward. Or you got to be this barbarian on the field. And then we got to treat them the same way outside of the field. You got to understand they're dealing with various emotions, pain, and all of the other stuff as well. So that's why I meet them at, and just, like you said, using music, I'll allow them to teach me things. Because we can't come at them like, oh, I know everything. Yo, teach me something. Or I play video games is a huge one too is a huge tool that I use. I have a console in my office, and sometimes I'm getting kids to engage that type of way. And don't force the relationship. Sometimes you just gotta let it mature naturally. And sometimes that may take 3, 4, maybe even 5 sessions. I know Dr. D have probably engaged with individuals where when they first come in there, they're not talking at all. They have nothing to say. They don't feel like they need to be there. But then as they continue to feel more comfortable, you understand that developing a relationship actually starts with developing that trust with them and understanding that you're not going to hurt them, that you're not going to disclose any unnecessary information to any other individuals, and then actually explain to them what therapy is like.
You used to be a football player, right?
And
I'm sorry,
I'm
sorry, Dr. D, that I hijacked this and turned it into like a sports psychology.
No, I like this. I like this. This is good.
So you used to be a football player, and in football and like other sports like hockey and everything else, they teach anger. Get angry at the line. Get angry at the line. And then, man, I wish I knew who it was, but there was a pro football player that said, I changed my game when I stopped being angry when I stepped onto the field and I played better. And it's such a mentality of football specifically to get angry, use that aggression. And then you just, you hold on to it. I'm sure you understand what I mean. So how do you break through that barrier to sort of stop a young adolescent student or athlete or person in general from being so angry at society or carrying that anger all day?
Well, one thing is helping them understand where the anger comes from. What actually feeds into it? What are your triggers into that anger? Is it your environment? Is it your home life? Is you dealing with an abusive parent or any of those types of things? Helping them identify those things, but then also figuring out how to channel that anger. A lot of times like you said, you want to use that anger on the field. No, we need to start dismantling that anger before it gets to the point where you explode, because a lot of, when you said, football players, you use anger on the field. So what if you don't have the field anymore? What if you don't have a place to create those outlets? How are they going to express themselves? That was one thing for me. But I suffered a knee injury my sophomore year in college, and sports was done for me. That led to my spiral into my depression, and also which eventually led to my psychotic break. Went through a period where I was stuck in my dorm room and wouldn't leave my dorm room or talk to anyone else. It was going on for about 4 or 5 months. And so you isolate and withdraw from people. I lost about 25 pounds over 6 weeks during that time period. I went through a period where I didn't sleep for 2 full weeks because everything is put into that game. That's where you channel your emotions. That's your frustration. That's where you let your frustrations out. And then when there's no longer there, I don't know what to do. That's what actually led me to, I was hospitalized. I was in restraints. So I know what it's like to be in a hospital and, you're under examination and you have all of these nurses and doctors asking you all of these different questions and trying to figure out, what's going on with you. But then also as a Black man in a hospital and nobody in the hospital looking like me, I was like, no, I don't trust you. I'm not talking to you. I just want to get out of here. Because also my identity was based into being this athlete, being this scholar. And I came from a small town. So I was the man coming from where I came from. And now I'm in a psychiatric ward. Like, no, this can't be me. I'm not going to allow you to label me, but then also I need to figure out how am I going to get out of here. And so that actually changed my perspective. And then to answer your question is getting these adolescents and these football, even it's not even just adolescents, man. It's even grown men that out here that don't know how to channel whatever emotions they're actually going through. So creating different avenues for them to do those things. And it's not just sports. For me, I journal. That's why I started doing yoga. Just different aspects of just life that can allow you to release those things and channel those things, but then also accurately identify what they are.
And I think it's because that must have been very, very difficult. And it resonates to how, especially with men, I think even in this country, because of the idea that men are supposed to be stronger and they're supposed to be the provider. And think about it. I mean, we're in the Middle East. And we still have a lot of these traditional roles that men are supposed to be the caretakers, the providers, the ability to hold their emotions. I mean, here it kills me when you've got a little boy who's crying and they tell him to be quiet, don't cry, or don't be a little girl. And suck it up. And, even when I'm teaching in social psychology, I don't know if Mahdi remembers, but by the way, Mahdi used to be my student and he graduated in 2008 with a minor in psychology. So he has been that's how I know Mahdi. And also because that's why we do this is because I know his passion about psychology and psychotherapy. And but the idea is that even when I teach it in social psychology and we talk about gender, it's most of the time it's like in my class here, it's very different because I also taught in the US and here it's like, well, there are certain specific roles. Like, a man is not supposed to talk about his feelings. A man is not supposed to express, no, I don't cry. I was told not to cry. I always tell the guys in my class, I feel sorry for them because then when they get married, especially with the millennials and also the 21st century, is like when he gets married, then the girl is like, why don't you talk to me? Why are you not expressing your feelings? And the guy is like confused. He's like, okay, I don't understand.
I don't know how
I was brought this. I don't know how to. And this is what a lot of here, we have high number of divorces. And most of the time in my experience, in my clinical experience, is oftentimes communication because he has certain roles here. He goes to work, he comes back, he eats dinner, lunch with the family, takes a nap, and then he goes to these places where they have gathering. They're called diwaniyas, where all the men sit together. And sometimes they do business deals. Sometimes it's just guys hanging out, And now, of course, 100% of them don't do that, but the majority of them do. So you got, they talk very, very limited. And so when you were saying, like, I don't know how, and even back, a lot of times coaches, they don't really talk about feelings themselves. They inbred this message and, Mahdi can correct me. I'm not a sport addict or have been in any sport, Mahdi's trying to get me to do CrossFit. I do work out, but I'm nothing like you guys. But I also remember myself, like, how is it like the idea is that even in high school or even in college, like I've hardly ever like met a coach that said, every time you say that you're studying psychology, they give you this like, obviously I'm much older than you guys and maybe coaches have changed, but back in my days, it's like, he'll say something about who talks about the feelings, who cares? They go out there, they should put all their energy in the field, and that's what makes a team. When he's giving them a talk, he's not really trying to be, someone that they can come to talk about their feeling. I mean, and the idea is that he's there to mentor them, but not really with more physical mentorship. I don't see it as more mental mentorship. And so, I mean, it depends, but I still feel, so when you were saying, I don't know how, of course, like even athletes at our university and a lot of them will take my class and you could see the difference. Like when you talk about feelings, they're just listening to you. They're not really interested in, they just want to get an A and pass your class. So it's like, when you ask them about, well, what do you feel about that? Or what do you feel about that? They're just the athletes at the university. Like, who cares? They don't know how exactly. They don't know how. Mm-hmm. And so they'll feel a lot of things. They'll go put it on the field and that's it. And they think this is it. Like catharsis doesn't really work. The idea is that people used to think that if you, punched a bag or like screamed and that should help with you, their aggression. We all know that doesn't work anymore.
I disagree. I still disagree. We had a whole episode on that. I still disagree. I mean, I think
we disagree.
No,
mean, of course you could, these things you could do, but does not eliminate talking.
But if you're releasing that anger, and I'm sure you can relate to this as an athlete, if you're releasing that anger in a positive way where you're applying it to a sport like CrossFit or something, and it's not anger, but you feel good. It's cathartic. I mean, it feels good for you. You release it. And, maybe talking a little bit, but some athletes, my generation, we didn't grow up with talking. And,
of course, none of them grew up with talking.
Right.
I knew how to channel my anger and channel my feelings on the field or, in the gym. That was it. And it still works for me and it works fine.
I think one thing too, it's not even just channeling anger. It's channeling any type of emotion into what, we're doing on the field or in the gym. And for me, a lot of times I go so hard in the gym now because I love that soreness after the fact because I feel something.
Yeah. Yeah.
But again, it doesn't take away the talking about it. So of course we can channel it. I mean, that's why I work out. I know for the last 1 week when I was lazy and I'm thinking, what the hell is happening to the world? I didn't work out and I could see the difference. Like even my son says, Mom, can you please call your trainer? So he can tell. Of course, channeling it is important, but I feel like sometimes, maybe not you guys, but I feel like sometimes, especially with athletes or people that just work out, they think that that's it. That's a solution. But then what happens when it happens like to you, Rwenshaun? You did channel it into your sport activity and then suddenly you get injured because a lot of these athletes get injured. And that's when they need to find another way to channel it, which is by talking about it. But if they don't.
I feel like it's a combination of things. It's not just one correct answer when it comes down to doing it. It's just, I feel like you need to have the physical aspect, whether you were exercising, but then also the talking about it aspect. And then sometimes talking about it may not be the thing for men. It's finding ways to get those emotions out. And then being able to process those emotions to why you feel that particular way. And I know I have a client that may not want to talk, but he will write everything.
That's right. Journaling.
Yeah, sure. Journaling is huge for him. So we can't just put put everyone in a box to say you have to talk. But yes, I agree. We need to get it out to figure out what it actually means. But there are different ways to. But some people do it through art. They may, paint and so do all different. They may do place things and all. So it's different avenues to do it. So I think it has to take It should be a multi-level approach to it.
No, and I think that you're right. I mean, when I say talk, I don't mean just talking, but the idea of like having like psychotherapy, it could be art therapy and it could be. It could be, and actually, a therapist, when you meet someone and they, like you said, like a lot of times people come and like, how can I help you? What can I do? What it would be the best thing for you? And the idea is that, I don't know. I don't really know. And sometimes I'm sure as your experience, sometimes they come with one problem, but they really have another problem.
Right.
So they don't really know what their problem is. And, and some people are not talkers or they haven't learned how to express emotions. So that's why we have to ask them to journal it, for example, or we have to be able to target into what is there. But to just say like exercising is going to be able to put all my emotions out. I mean, for me, I feel like it's something that is, that requires so many other skills. Like I can work out and I can write my feelings or I can draw my feelings. I can attend classes that teaches me how to express whatever it is that requires it. But we can't just put it on one thing. Like athletes can't just think, well, when I go work out, I'm channeling it, I'm fine. Because
I don't too also with athletes is, especially when you're talking about collegiate athletes and professional athletes, when you get to that point, they're working out is their job.
That's true.
But I do feel like exercise and, working out, that those things help me calm down so I can be a more effective communicator.
That's true. Very well put. Exactly. So it helps me calm down and I have to be so angry and then I could actually concentrate and think about it. That's very true. Very true. So now we have to get
Rwenshaun,
ready to talk.
I see. I hold on. I wait for Dr. D to finish, you to finish, and then I'm like, all right.
You always surprise us.
I know. I'm going to surprise you right now, dude. Talk about your book a little bit. Injured Reserve.
Oh man.
I mean, dude, talk about that a little bit. I honestly because this came up so fast. Usually I read the books or I try to read, I read up on the person a little bit more.
Yeah.
And I was very intrigued by the story and how to get my hands on the book and check it out, dude.
Well, you just shoot me an email after this where I need to send it, and then I got you. You too, Dr. D. The book is really based off of my journey. I mentioned earlier, I'm from a very small town in rural North Carolina, Bertie County. And when I went from I grew up, I was a 3-sport athlete. So football, basketball, and track. I actually went to the University of North Carolina at Chapel Hill on an academic scholarship and walked on to the football team and the track team there. And so during my sophomore year, I got injured and I ended up in the hospital, received a diagnosis of bipolar 1 disorder with psychotic features. So during that time period, I was hearing voices as well. And so the book actually goes into depth of my actual story, but then it didn't stop there. It actually, after I left the hospital, I ended up withdrawing from school for a little bit. I started to see a therapist, Dr. Kendall Jasper. And that was a game changer for me because he looked like me, he talked like me, he dressed like me. When I first saw him, he actually had on a T-shirt with some basketball shorts and some Jordan. And I looked at him sideways. I was like, "Are you sure you're a doctor?"
So that affiliation was there right away. So you can.
Yes, it was right away. And so he made me feel comfortable. And he's also just an inspiration for the way I do my work now. But after I saw him, I got the treatment that I needed. I actually saw a psychiatrist as well and got on the correct medication that I needed. Of course, that can take time to do that when you're juggling because that's no exact science. And once I got better, I was like, okay, I want to go back to school. But the ignorance in me actually said I was cured and never really realizing what this meant. This was a lifelong journey. And when I went back to school, I wasn't taking my medication. I wasn't going to therapy and the symptoms ended up coming back. And instead of me going back to therapy, I started to self-medicate with alcohol. So I was going through a fifth of tequila, every other day for a little over 3 years. So during that time period, attempted suicide 3 times, attempted to overdose on pills twice. And then the last time I put a gun in my head and pulled the trigger and it jammed off. So the book actually goes through my journey from the initial diagnosis into that last suicide attempt. And I actually bring in some of my own journal writings through that time period where I'm actually going through the different thought patterns and just what the voices were saying while I was, doing these types of things and the things that actually led to me wanting to end my life. Because it wasn't really about wanting to necessarily die, but I wanted the pain to stop. And then a lot of times we hear that people, think about suicide as something that's selfish. But actually, I was thinking about my family wouldn't have to worry about me. If I'm no longer in pain, they're no longer in pain. I know it may sound irrational to someone that's thinking logically, but that's what my thought process was at a particular time. And then also with the book, I wrote it as a guide for individuals. As you're reading each chapter, I have activities for you to do at the end of each chapter and leave you a space to write. So I want you to figure out what things do you need to start incorporating in your life so that you don't have to get to the point where I got to. That's identifying your protective factors. Who's your support system? Identifying your triggers and all those. And so I tell my story, but then I also want the reader to get something from it too by starting to assess their actual mental health and their mental wellness and the things they may need to change in their own life, whether you have a diagnosis or not.
That's amazing. That's something every athlete should read, to be honest with you, especially the athletes that hit that age or that peak of 32, 33, 34, and the downward spiral comes in of, I'm not a pro. I'm not making $1 million a month. Now I have to shift gears and earn a living or figure out how I'm going to earn a living. And a lot of them go into being a trainer or a coach and they make a career out of that. But that fulfillness, that self-fulfillness, you know what I mean? Like being happy because, you're doing something on the field isn't there. So I think that book would be amazing to how to transition past that point. That must have been hard for you, man.
Man, it was tough. It was very tough. And I actually used the book too, even to teach younger individuals as far as how to deal with their things as well, because we get so, as an athlete, you get so caught up in just your sport and you lose who you are as a person and then you started doing the things that you feel like you have to do that lines up with that persona of being an athlete. And so that's what also hurts individuals after they stop playing sports, because you never really had a time to explore who you really are.
not only that, I think it also, I mean, it's amazing that you got diagnosed as bipolar and you're able, and I think more people need to understand about bipolar. And a lot of people have been to, they get better and then they stop taking their medication. And then they go, same stories. They'll go back to school or to work thinking I'm doing great and I don't have to take medication. And that's it. And then they don't understand that it's a life-altering disorder, that you're always going to be living with bipolar and you have to learn how to manage it. So I think this book would also be able to help individuals to understand that there is a way to live with bipolar and be functioning. I mean, here you are working on your PhD and you've managed to get your master's and you finished your bachelor and you're able to maintain because you realize that there are certain medication I have to do, that I have to continue with my therapy. There are certain things I have to do for myself, but that I have to accept that I have this diagnosis. And
right,
I think you have to own it and you have to realize, I mean, I have a lot of patients that start medication, but then when they're manic stage, then they feel so good and they like that extra energy. They can come up with so many creative ideas, that they have these like ideations that are like grandiose, and they'll start to like, no, I love the way I have so much energy. I love the way this makes me feel. I don't want to take my medication because taking my medication will make me, lose that or that, that whatever. And so even the people that don't have bipolar, but even people that are diagnosed with bipolar, they're not really, especially here, like, because it's already a stigma to take medication. And it's already a stigma that you have to go. And the idea of them to accept that this is a diagnosis and that needs medication and therapy for pretty much lifelong event, they don't want to accept that. What they want to accept is that, okay, you've got this diagnosis. It's like, that's it. I'm going to take medication for a certain time and maybe stop it, and then I'll be fine. And therefore, and you know what happens? They go into the cycle and then they become depressed, they become suicidal, and then they realize that you have to be able to do. So I feel like people like yourself also, and also that you are a therapist, that you can also help educate in this field. Because I think people don't really understand bipolar. They don't understand. Actually, a lot of people don't understand mental illnesses.
Right. Agreed.
But definitely, since I've been here and I've been practicing, I feel like a lot of times here, when I first came, I felt like I had to like really take small steps to educate individuals about like saying like, I don't want to take my medication, but you need to take your medication. No, I don't. I feel like, my mom said, you don't need medication because this kills me. Is when people when people are not doctors are starting to tell me my job. No, I don't want my daughter to be on medication because I don't want her to be addicted. Okay, well, all this idea about, well, our medications are not addicted. Some disorders, you really need to have medication. No. My mom said I can't take medication. My mom said if I get married, especially here, it's very cultural and a lot of them are married in traditional ways. And even if they're not married in traditional ways, they're ashamed to tell the person or their partner that they're on medication. So she wants to get off of it before she gets married. How am I going to tell him that I've been diagnosed with bipolar or depression or OCD, for example? So constantly they're living in this bubble of secret, right? And then in order for her to avoid this secret, well, I'll just stop my medication. I know I'm going to do exercise and diet and I'll be fine. So there's limit education. And no matter how many you have, and actually within this last maybe 5 years, maybe a little longer, we've got more and more people getting educated, more and more people open to the idea. And maybe because we've globalized and people can watch Netflix and watch movies about mental illnesses. But still, it's still the idea of like, I don't want medication. Most people will message me and say, do you do medication? No, I don't treat with medication. Okay, good, because I don't want to be treated with medication. And then I have to clarify and say, look, but if you're diagnosed with something that really requires medication, I have to ask the psychiatrist to put you on medication. No, I don't want to do that. So there's constant struggle. So individuals like you also, that also helps, not only with athletes, but I think understanding bipolar is a serious disorder.
Rwenshaun, real quick, I think Dr. Dinker brought up a really good point. What is it like for the African-American community and the acceptance of mental health, man? Because you do a lot with the African-American community. So what is that like in accepting mental health?
It might be similar to us. Let's hear this.
And honestly, like that's what I was going with it. Exactly. Like I mentioned earlier, the culture of stigma itself impacts everybody.
Yeah.
And it's very, as I listened to what you were saying as far as, the Kuwaiti culture when it comes down to addressing mental illness and people living this, it's like a secret society of who is diagnosed with what, because you don't want individuals to know. Even if you're living with a spouse, you don't want them to know what you're actually going through. It's very similar in African American. That's why I do what I do, how I do it, especially when it comes down to medications. You have parents that don't want their children medicated, which I understand because they have side effects and all of those things. And then actually too, I've seen a lot of misdiagnoses, and some of my kids have been over medicated. So I get it, and we don't from culturally, from an African American standpoint, we don't trust the healthcare system. Because we in the past we were treated as lab rat, for lack of a better term. I definitely understand it, but me understanding my own culture, I work within my culture to be able to psychoeducate individuals, but I bring it to them in terms that they can actually understand, but then also what they're receptive to. But then also I utilize a holistic approach. Yes, medication is necessary for some people, but then also diet is a very important role. How much physical exercise that you're getting plays an important role. But then also even the other things that we consume, whether that's how much screen time are you getting on your phone or on your computer? How much are you able to really get out and move? So I also incorporate those types of things into my educational phase of individuals. And as I see it, during my journey, I understand that me sharing my own story has allowed people to feel comfortable with opening up to me. And then that way...
Because they'll know you understand, and they'll know you're not going to call them crazy.
Right.
And they know that you won't be able to be pushing them to certain treatment or medication that you don't understand, of course. Right. And also, especially in the African-American community, for example, then there is what you were talking about, it's called healthy paranoia. And it, of course, because they've used African Americans. I remember when I was in the US, I was just finished my master's, and I was working at this hospital. And so I remember it's the amazing thing is like people don't understand culture and how they misdiagnose individuals because they don't understand the culture. So there was this woman that came in, I think she might have been Palestinian. And she was, in our culture, especially the older Arab women, they don't do eye-to-eye contact because, you're not supposed to look at the man in the eye. Mm-hmm. And so, of course, I'm Arab. I was in the U.S., so studying. I'm in the emergency room, which I love doing crisis work. And here there's this woman who apparently just had a psychotic breakdown. Mm-hmm. But she was very depressed. She had just lost her husband. And then we had a Chinese psychiatrist who came to evaluate. He was on call. He comes in and she's not giving him an eye contact. And she's just like, he's asking her and she's just looking around. And of course, I'm translating. And then he's like, so he suddenly, what's her diagnosis? Schizophrenia. And I'm thinking, it can't be schizophrenia. She's not psychotic in that way. She's like exploding, but she's not delusions. She's not hearing voices. Hearing things, right. She's not seeing things. I said to him, Doc, she can't be schizophrenic. And then, of course, I'm the student. And he's like, what? You can't be teaching me. I said, why did you think that? Anyways, I thought almost I was going to be kicked out of that hospital, lost my degree. And he's like, she didn't give me eye contact. He said, she didn't give me eye contact. I said, that's it? I said, Arab women are not supposed to look at you, especially older women. I mean, imagine my mom. I don't even think my mom's ever looked at a man in the eye unless it was my dad. It's just like, not like me. I mean, I was brought up in the U.S. And he's like, she didn't look at me in the eye. She didn't respond. I said, first of all, I was translating. She has to look at me. I'm the woman, so she has to look at me. And I'm supposed to be telling you, no, she's schizophrenic. So he puts her on psychotic medication and her condition was worse. So I could see what you're saying. So it is healthy paranoia to think that, they don't understand our culture. They don't understand where we come from. So of course they're going to misdiagnose me because of some nonverbal gesture I just did that, DSM-3 at that time, I don't know, 4, wherever that was, that said that was one of the symptoms. And I saw it myself when I was being trained. And here it's the same thing. It's like, when people don't understand that here is not just culture in general. You also have to understand like particular family culture, tribal culture.
Right.
You have to understand. And if you don't, you're going to be, and so you're not going to trust everyone that's going to come and diagnose you and introduce you to ideas of some sort of mental health that you don't really are aware of. It's the same thing as in the US. I mean, cannot believe, that's one story I remember, how many other people, there were African-American, Hispanics, and Arabs that were misdiagnosed. And you can't challenge a psychiatrist because it's like, who are you? You're just a student. I was scared to say something, but I thought, no, I have to say something. And then he's like, no, she's schizophrenic. Actually, I remember to this day, his handwriting, paranoid schizophrenic.
Wow.
And I was like, wow. So I went to tell my supervisor. My supervisor says, you can't do anything about it.
And that's bad. So I got a question for you, Dr. D. As you've transitioned back to being in Kuwait and then you understanding how culture plays a large part into, just our mannerisms, how we react to certain things, how do you go about the diagnosis process? When you incorporate culture into when you're working with an individual?
It definitely is something we have to keep in mind a lot. The idea is that, and for me, it's like, because I'm from the US and Arab, the idea is that a lot of times people are comfortable with that because then they know that you can understand both. Actually, just last week, one woman said, I refer you to a lot of people, especially people like her, because a lot of people, the newer generation, look at Mahdi. Mahdi's Kuwaiti American. And he's like, so he's from both cultures. There are a lot of people like Mahdi, or there are people here. I don't know, Mahdi, if you remember, but I don't know when they started having these private schools. So there are people that go to all government schools that only do Arabic. And then there are people that go to private schools who are like English schools or bilingual schools, but they are American curriculums or British curriculums. So even that we have to keep in context. So even if you are Kuwaiti or Arab and you went to an American school here, still in Kuwait, you are being taught American curriculum, you're speaking English, American, and you are trained by American. All your teachers, all of them are Americans that come from America. So actually that's a culture within itself. But then these kids go to their house and their house are Arabs or Kuwaitis and they're speaking Arabic, for example. So they have to have both. So sometimes here, like the reason why I said that is because this girl says, I refer you a lot for people like me. So there's a lot of, millennials, for example, or even people that have grown up only in American schools, but they're still Kuwaitis. So she said, because the other day she was talking to her cousin, and her mom took her to this Kuwaiti psychologist who was talking about religion. And was telling, so this girl already feels guilty because she's doing things she shouldn't be doing as a cultural norms.
Right.
And she didn't tell me what they are, but it seems like maybe dating or something, drinking, drugs. And she was like, so she's like, so her aunt was telling her, well, I took your cousin to so-and-so. And he was like, trying to tell her, you got to be more religious. You're not praying. You're not doing all these things. And the girl is already feeling guilty that she's doing something wrong. She said, and this guilt added more to her that she's more depressed. So the aunt is telling my client, you know what to do because this girl's gotten worse since I took them. And the girl is like, because you're not supposed to take them to people. They're just talking about religion. You should be taking them to these individuals. Your daughter is mainly American, or at least her mentality is very Western. And she should be with someone that can understand both languages, that is not going to bring in religion or politics. And here, so that's one of the things that's an advantage for me because I don't talk, I'm trained in the US. We don't talk about religion. We don't talk about politics. Definitely religion. I respect your spirituality. I ask people what relaxes you. What do you meditate on? If it's music, if it's listening to the Quran, if it's the Bible, I don't care. Whatever it is, you do it, but I don't bring it into my session. But then the older psychologists here are pretty much not trained in the West. They bring in this idea of spirituality and religion, and you should be praying. And that just bombards the client with more guilt. So for me, maybe a lot of times they're more comfortable with me because I'm more accepting. Like if someone wants to come and say I'm gay, I have a lot of people that come out. And actually a lot of people will come to me if they want to come out because I'm American. It doesn't matter to me if they're gay or not. So they know I won't judge them, but there is no way they'll go to another psychologist, for example, who's very traditional, who may be religious in their training and be able to talk about I've come out, or I'm gay, or help me deal with that process. So these are things that we don't talk about them in this culture, and they're tabooed. So the idea, or like if they're drinking or doing drugs, unless they've, now more and more people are recognizing that they have an addiction. We do have an addiction center. So they'll come and tell you, but they won't go and tell someone else that's not Western trained, because they're worried about being judged. So it's because here it's like a big thing about me. They're already taking the step to come and see you. And nevertheless, I have to make them feel guilty because they're gay or they're homosexual or that they're alcoholics. It's not my job to do. And a lot of times people find comfort in that.
Right.
And there are more and more psychologists being trained in the West where they're accepting. But you have to think about there's also a big number of psychologists who are not trained in the West, and they don't have the Western mentality. And maybe even if they did, they think it's very wrong to use it. And they want to use the traditional deal of, what religion says and how you should apply your religion. And there's still some psychologists here that says, well, you will feel better if you just read the holy whatever Quran or the holy whatever the religions, their religion. They still have that mentality. For me, that's so serious that because I already see people that are guilty, they're depressed, they're worried about, their mental health. They're worried about people and their judgment. And I feel like that component can make them more guilty, I think.
Right. Definitely see some of that as well over here when it comes down to the religious aspect. And for me, I started to learn how to work within those realms. And I know we, especially in America, are not as strict in certain cultures as it is in Kuwait. And but I definitely can see an opportunity for teaching individuals how to utilize those tools to work within those. But it's definitely an uphill battle.
But if the person says yes, I like to,
right.
I mean, for me, I don't because but to me, it's like I don't discourage it. Of course, whatever makes the person, as long as they're not harming themselves and they're not drinking to death and doing drugs and things that are harmful. If they think that, I like to go to prayer. Why? I go to prayer and I feel very, I'm spiritual and it makes me feel good. But if people say it makes me feel good, but I don't bring it up as a requirement.
Right.
If they are not, if they're dealing with a lot of strong issues that goes against their religion or their culture. So if they don't bring it up, I don't really talk about you got to go pray. That will give you some sense of peace.
Right.
There are lots of people that say to me, I'm spiritual, and I leave it to that. Whatever their spirituality is. Some people even tell you that, I don't have a religion. And I don't say, no, you should have one.
Right.
And I'm sure in the African American community, spirituality is a big thing. And,
it is.
And church is a big thing. And a lot of people do find comfort in that. But it's not. But we can't expect that every African American that I'm going to see.
Exactly.
Yeah.
Right. You can't push those beliefs on individuals. So it's like, again, it goes back to meeting the people where they are and treating them as a person first, and then understanding how you need to interact with them based off of their beliefs and their actual preferences on certain things.
That's very true. Very true. Mehdi, we lost you.
No, I'm still here. I'm just listening. I'm letting the two psychologists duke this out, man. I mean, I got nothing to say. I'm just like, all right, let the psychologist talk about this. I'm staying away from being diagnosed tonight, man.
You're overwhelmed, huh?
Yeah, I'm good.
Finally, I have a guest that's on my side. Thank you, God.
Hey, look, he's an athlete, so I got to agree with him. He's an ex-football player. The guy can lift mad weight. He can do yoga. I mean, shit, he's got me beat, so I'm good, dude. I never met a psychologist that could beat me in the gym, so.
Well, I can't wait till you come here. I can't wait till you come here and you train with him.
Oh, look, I'm looking forward to it.
Are.
I'm really looking forward to it. But no, I definitely appreciate the work that you all are doing when it comes down to addressing these issues from a different perspective. A lot of times it's one thing we talk about mental health and just mental illnesses, but then you got to add that cultural aspect to it. And you have to add that perspective to it. From the athletic standpoint or being even from the ethnicity standpoint, it's important.
No, and we can't minimize it, actually. I think it's important. And even if I am living in, I thought to myself, if I came back to Kuwait and I work with individuals who are like myself, then it would be easier. It's not easier. Culture is still a factor here, and norms are still, and you get someone that is like, very Western as a kid, for example. A lot of my students are very Western. And then they're living in homes with parents that are not. They can't even speak English, the parents. And, that also impacts them. And I think that it doesn't matter where you live, that these factors have to be considered. And, I remember when I was in the US as an immigrant, and here I remember this is like talking about culture, and reminded me. So my parents were very, very traditional, and I immigrated to a small town in Pennsylvania called Waynesboro, Pennsylvania. And so it was a very small town. I don't think they've ever seen an Arab family before. We were like the first one ever at that time. Of course, my parents don't speak English, and we went to a local school. And so I remember that there was going to be some sort of a dance, whatever dance that they have. And so the counselor told me, you have to tell your dad that you got to come to this dance. It's very important for you to mingle with the other students so you could learn more English. And, it's important. And for us, all girls come. She was giving me all this advice that my dad would have shot me.
Right.
Seriously, I would have been dead. So I didn't know. I went to my dad and I said, look, my counselor says I got to go to this dance, and there's other guys, and I got to meet other guys there, a lot of girls. And my dad, I swear, I thought that he was going to, that's it, lock me in a room and say, you are never going to speak to another American again.
Right.
The advice was bad for me because my parents are very traditional, and she's saying you should go out, you should date, you should go to dances, you should mingle with these Americans. And my dad is like, what the hell did we do? I need to go back to my country. This is, so I felt like this is like when I started thinking I should become a psychologist, because people really don't understand what you're going to put people at risk when you make advice to them. That is very dangerous, I think. That's why. Yeah.
Sounds like coaches. I mean, those life coaches.
Exactly. Yes.
I was talking to someone about that earlier today.
I only speak when I have something worth saying. And life coaches, I think that's something we could all agree on, that we could just kick a life coach in the teeth and not, not lose any sleep over it.
I was going to ask you, Rwenshaun, do you guys have these life coaches also? We have them. I don't know where they came out of the blue, and they're populating this as of and they talk like they're therapists. They've taken, what do? They take one course a year, just a 1 year course.
Some of them not even taking courses because there's no credentialing thing to it. Some people just consider themselves a life coach, and it's very irresponsible for one, and it can be very damaging to individuals when it comes down to when they want to seek help, because we've been talking about stigma this entire time, right? So let's say if someone gets the courage to actually go seek some type of help, and they're getting help from someone that doesn't have the skill set to do it, you're really doing that person injustice, and it's going to set people back.
We had a life coach on here a while back, and she was also my student. And after she got her bachelor, then what she did, I can't remember, but she did this one course for 1 year. And she was saying how dangerous it is, because a lot of times here in Kuwait, coaches, life coaches could be cheaper also. And a lot of times people going to a life coach is very different than going to a psychologist or a doctor, which makes them less crazy, right? So even if they're not cheaper, they'll go to a life coach because it's less threatening. It makes it look like he's your friend. And so they think they're going to a psychologist. And she was saying a lot of times people don't understand. So they'll come, and these life coaches, they are redirecting them wrongly. For example, you're not supposed to work with serious illnesses, for example, or serious issues. They're supposed to be just dealing and managing your issues that are like life-to-life skill. And she was saying that she knows coaches that are actually will see someone that's going through maybe some sort of a severe depression, or they have really severe issues that are not within the capacity of the coach, but they'll keep them and continue to give them wrong advices because they don't want to lose business. And we don't have a jurisdiction here for life coach. So anyone can go claim their life coach, and they're busier than psychologists here. Can you believe it?
Yeah, I can believe it. It's very similar here as well. Yeah, I can definitely believe it.
Yes, and because they assume that they're psychologists. And that's, so the idea is that they give the wrong advice. They don't even say, she was saying that they don't even say, look, this is beyond my capacity, because they're too proud.
Right.
They don't say that this is an issue I don't deal with,
right.
And so they don't refer to someone else, because then that would make them look bad or less, So it's true. So I don't know.
I definitely think this is a topic for a full episode that we all could do, and we can share our insight from east to west on this.
Definitely.
Yeah, I think it would be a hell of a topic. And Rwenshaun, like, I'd love to have you on the our sports specific show.
Okay. All right.
And Dr. D, you could jump on with that too. I mean, we could talk. It will definitely have mental health involved, but I'd also like to talk to you about training and the training modalities that you've gone through, and the mental aspect of switching up modalities, and this thing that all athletes and gym junkies go through, which is, I'm going to lose my gains, and right now in quarantine, everyone's going nuts buying gym equipment.
Right.
And like, dude, I'm one of them. All right, man. I'm one of them.
Oh, me too.
I bought a barbell. I bought plates. I turned all my Under Armour backpacks into sandbags. So like, I'm good.
Gotta have it.
Yeah, dude. So I mean, it would definitely be a good show. That we can offer up to the athletes that listen, because we have newbies to, people in their 50s that are looking to get healthy. So it would be a lot of fun.
Right.
Man.
No, definitely. I'm looking forward to it, man. Whenever y'all want me to be on, I'm here.
Awesome, dude.
Oh, no, you would love it. Thank you so much.
You owe me your book. I'm going to read your book. All right.
Yeah.
You let me know where I need to send it, and I'll send both of you a copy.
Send it right to my email, man. Do you have the do you have an electronic copy? Just send it to the email I sent you the invite on.
Me too.
Okay. I got you.
Yeah.
You can leave Dr. Dink out. She reads enough. She's got a PhD. I'm the jock. I'm the jock of the group. So I need to educate myself a little bit.
Look, he's a psychologist. He's got my back. So don't even try.
See, I flow with both. I'm an athlete and a psychologist. I do both.
You can't do me like that, Rwenshaun. He has enough people on his side. I can barely get any psychologists on.
Oh, man. But no, I appreciate what you do.
Yeah, we really appreciate you. And thank you so much for joining. So definitely, there's a lot of other topics we could be doing together. And I'm so happy to have shared a lot of these things with each other. So thank you so much.
Yeah.
And we'll send you, once we download it, we'll send it to you.
Yeah, dude. Okay. Yeah, dude. Thanks a lot, man. I can't wait to geek out on sports with you and none of the psychology stuff.
I have one question for both of y'all right now. Before we stop, how are you taking care of yourself during the lockdown?
Oh, my God.
Dr. D,
I'm going crazy.
Yeah, you don't have your salon, so
Exactly. You want to hear my story? I don't mind them closing even my business, but I have been in crisis. They've closed the salon. The salons have been, no, you don't understand, Rwenshaun. I have 2 kids, and one is 15, one is 10. They're amazing children, but there is no playground. There's nowhere to go. There's no park. So here they are, and they only have piano now. Before they used to have skating, and now that's closed too. So for me, I don't do in-home services. I always go to the salon when I just want to be left alone. Where I can do whatever, and I can go 3-4 times. I know Mehdi is like, that's where all my money goes. It's true. I just go one, and sometimes I don't have anything. Believe me, like the lady's like, weren't you here yesterday, Dr. D? Yes. Don't worry about me. I'm just having a cup of coffee. I swear. I have a cup of coffee and I say thank you. And I give the girl that made me my coffee her tip. I leave. Now this has been my crisis. I've been trying to think, should I bring somebody home? But I don't know where that person has gone before. And they're very big here about make sure you don't call them in your house. You don't know whose house they were in. I do have kids. So that's been my crisis. Other than that, I could tell you that I am a workaholic. I work 3 jobs. And this has really made me, all the time, I want to be able to spend time with my kids. And I've always had other commitment, other priorities. This has really forced me. And I hope it has forced a lot of other people like myself, where they can really enjoy time with their kids. My kids, they can eat breakfast with me now. They can have lunch with me. And we have a series that we watch every night before we go to bed. That has never happened. I'm telling you, never happened. Like even when we go on vacation in the summer, we go for a month or a month and a half to the US. I am so busy trying to do all the things I was supposed to do the whole year that I was in there, or visit my friends, or I mean, they're with me, but it's not this tranquil. So to me, that's how I'm really enjoying it. And now I think my whole business will go virtual. Seriously.
Love it. I love it. I think it's gonna be a huge shift after this, everything is over with.
I love it. I love working out of the house. Before I was like, no, I don't know what this out of the house shit is. Not anymore. I love it. I swear, if I can do salon over virtual, I will do it.
Well, besides Dr. D's salon drama over there, no, I mean, honestly, like the first day, I was like, "Oh, this sucks," but you know what? You got to adapt to situations, and I look at it like I could be lying on a hospital bed when, in reality, I get the opportunity to spend time with my son, who in the future I'm probably not going to have as much time to spend time with. I'm with him from 6 a.m. all day. And I do have my mental breaks where I go and I work out for about an hour and a half to 2 hours. And it's good. I'm enjoying it. I'm actually kind of enjoying the quarantine and just enjoying the time that I have with my wife and my son, mainly with DJ because, let's face it, kids grow up, they forget about their parents, they hit that teenage phase. And, and for me, I mean, he's our only child and it's an opportunity. I'm trying to embrace the opportunity that I see in front of me versus, dwindle down in the sorrows and get caught up in all the shit that's going on. I mean, let's be real.
True.
Like it's, the world sucks. You're seeing thousands of people die every day. And it doesn't look like it's getting any better. The States, it looks like it's going to hit you guys right now and it's going to peak in May. So for me, it's like me and Haya, I go on my phone at night at 10 o'clock to check the news because I don't want any depressing shit at this point to draw down on my day. And that's it. So, I mean, it's just, I keep my sanity through that. And look, I hate staying at home. I never stay at home. And I've not left since we've been in quarantine except to go get some gym plates. And even with that, like it was like wipe down with Detol and do all the crazy shit. Right. So, I mean, that's the only time that I left. And you know what? I'm just, you got to embrace the moment. Just take it for what it is.
Agreed.
What about you, Rwenshaun, before we end? You tell us, what are you doing before we end this? What have you been doing? How are you doing?
For me, I think similar to both of you is enjoying being back connected with humans. I get caught up. I'm a busy person as well, hustle and bustle, but now it's forcing me to reconnect with the individuals that you normally just see them in passing by and, oh, hey, how you doing? And just keep going. But now we're getting creative. As yesterday we did a happy hour via Zoom and they were on it for 5 hours when we were doing so like, just
I like this.
So like things like that, you get creative and then you really, even when we was on it, we was like, oh, so what are we going to talk about? Let's figure it out. It's just creating that human connection. So right now we're not on a lockdown where we can't go outside. But they're suggesting they shut down the restaurants and certain things. So when you have nothing to do after maybe 5:30. So when you're just going outside and you talk to your neighbor or understand what else is going on with people's lives. So I'm enjoying that, human connection.
Yes, I definitely enjoy not running from one place to another and that sense of anxiety, to be honest. I'm enjoying that. Like today I was shooting for my TV and the director and the photographer usually were in a hurry. Yalla, I want to finish. I have to go to work or virtual. And today that 4 hours, 5 hours. I don't have anything to do. I said, don't worry. And they're not worrying. It's so nice. I love the way people are now. Like, okay, we've got plenty of time. We'll finish. People
I think I really understand
anxious.
now too what rest is.
Yes. Very true. Of course. So I'm enjoying it. Thank you.
I appreciate you all for having me. I look forward to even doing more stuff together. I'm going to get y'all that book today. I'm going to send it to you.
Awesome, man.
Yeah.
Yes.
And just let me know what you think about it. And I hope y'all have a good evening.
Thank you.
Thank you, buddy.
Be
Thanks,
safe.
man.
Stay
all
safe.
Yeah, stay safe, bud. Thanks, man.
Bye.
Bye.
Thanks for listening to this episode. If you enjoyed it, please head over to iTunes to subscribe, rate, and leave a review. You can also find us on Instagram at The Project Kuwait. Thank you, and join us next time.